morning, everyone. A very warm welcome to the second day of such a beautiful conference on orthopedics beyond books. And myself, Dr. A. Roopesh Reddy, hailing from Tirupati, my hometown, practicing in a village, Pilar, near that. And my topic will be, before that, I would like to thank Dr. L. Prakash for giving me a wildcard entry for this conference, because I didn't do any invention or I didn't find out any novel technique. Just I want to share my experiences and I will move on. This will hold good not just for a diploma candidates. I finished my Dorth in 2013. I think this will hold good for MS and DNB passed outs recently. And this is not a success story. This is just a part of my journey. However, I will not be telling you rules, the success story, follow these rules, you will be successful, because I am not that much aged to tell you philosophies of ortho also. In the next coming slides, I will be going through my life journey of 6 years. Whoever gets connected, you can join that and you can plan your life. Thank you. So what to do after just a diploma? As I said, this is not a success story. This is just a part of my journey. So if you put into another heading, what's orthopedics as a career present scenario? Education, I studied my MBBS from SU Medical College Tirupati and wrote PG entrance and got some 1000 rank, no chance of getting seat, and I am very much passionate about orthopedics. So luckily I have written Ramchandra Medical College entrance. By chance that year they have given D-Ortho on merit. So then I have studied there. I passed my D-Ortho in 2013. And what after Dorth? And I am aged about 28, definitely marriage after that. I married and then I joined a job in semi-urban town for a mere 50,000 per month salary. At that time I recognized MS people will get 70,000. And then here I learned principles of practice from my guru, Dr. Reddy. All the tips and tricks of doing practice, business, surgeries, don't think other way. Practice is not just business, okay? And I wrote after 1 year post-diploma set exam, after 1 year. And counseling was planned for tomorrow. My son was very hurry. He was born a day before. So I had to drop that plan. And then what I did? After doing private job for 2 years, I joined government job. And this I did for just 3 months. Because with my qualification, I got a job in primary health center only, where you cannot do any orthopedic practice there. And my wife used to yell at me that you are not meant for this, please start practice. And my boss too advised same. So I left that job and sit quiet for 3 months at home to give my brain some rest to take a big decision of future. And it doesn't mean, doesn't mean to say that everyone should quit government job. See, if you are not willing to do private practice and take such headache, if you are passionate about orthopedics and if your qualification gives you a job in medical college with more orthopedic load, that is the best place to serve people and that is the best place to give the best care of orthopedics. And then what are the options left before me? Practice or again go back to corporate job. I took practice as a choice. And then comes the question, where? Rural or urban area? The point is, in rural areas, you don't need any super specialty degrees. Whereas in urban areas, the patient before stepping into your room, he will see your degrees, calculate what are the qualifications he had, fellowships he had, and comes inside. So what about corporate job? See, they will pay you less and you need to work very more. And my salary after 22 years is from 50,000, it got increased to 90,000 per month. That's in 2015. And one fine day, I came to know that MS orthopedics guys and fellowship guys who were juniors to me are making more money than me by doing corporate jobs. So, you should work at least for a year in any corporate hospital or a local orthopedic hospital before starting practice on your own, because you need to understand the dynamics of the surrounding areas, of the public, what public looks like and what they want. And then I started thinking seriously what I am going to do. Should I start practice or DNB, FNB or anything? Ultimately, I need to start practice. My preference was rural areas from day one. I feel a bit irritated to read Google patients who will come with phone and then do this, that, do the stat and all. For this, I think spending a day extra for doing other degree will be a waste because no one cares your degree in rural areas. Why I am saying is, I started practice in a village where one physiotherapist practices for the past 10 years. And after practicing 4 years also, patient will come to me and say, we have been earlier to that big doctor, sir. Now people said that you are seeing well, so we are coming here. That means they don't know the difference between a physiotherapist and orthopedician. That's not their mistake. That's it. That's the patient's education now in rural areas. So why I choose rural area? Every town is saturated. My hometown Tirupati, including all the PGs and residents, there were around 80 to 100 orthopedic surgeons. So I choose a place where there is no town in a radius of 55 kilometers. And the most important thing is, I am happy with semi-urban lifestyle. This is more important before you plan. Service can be done to the needed. And what's the need? Why are we talking about this? Are we concerned really about rural India or just orthopedics over there? When you look into the population, 70% of Indian population live in rural areas. As per 2011 census, out of 121 crore Indians, 83.3 crore live in rural areas. And when come to the accidents, there is one fatality per every 3.5 accidents. So according to Andhra Pradesh 2008 road traffic accidents, article says roads are bleeding. It shows in 7 months there are 11,969 RTAs, out of which 6,088 deaths were recorded. And the reasons quoted by AP Transport are blind curves, lack of signboards. That is not related to us. Then what is related to us? No trauma care centers nearby. So what's the government is doing? Government looking to improve health care of rural India by appointing MBBS doctors in primary health centers. But that doesn't solve our problem. Why? Rural India needs special trauma centers with orthopedicians, and government cannot appoint orthopedicians in primary health centers. So now comes the point need. Who actually need rural orthopedics? People of rural India for their better health, or orthopedicians of urban India to earn their bread and butter? The answer is simply both. When you come to doctors' density, WHO says it should be 1 per 1,000. And 6 states of India have more than this. And yet, rural areas remain still underserved. So in Tamil Nadu, it is 4, equivalent to Norway and Sweden, having 4.3 and 4.2. And in Delhi, it is 3, higher than UK, US, Canada, where it ranges from 2.3 to 2.8. And this is the article quoting the doctor's density. And coming to the urban scenario, I will take Karnataka as an example. 40% doctors of Karnataka are in Bangalore alone. Cities are getting saturated even for specialists. So as a result, they don't get jobs. Salaries are coming down. So many are fighting. I will work for 1 lakh. My junior will go and say I will work for 80,000. And his junior will go and say I will work for 60,000. Too many doctors in the same place. They resort to unethical practices. On few patients, they get to meet their financial ends. Ultimately, you need to pay your EMIs for everything. So ultimately, you need to resort unethical practices if the patient load is very less, and you need to share among the so many colleagues. So what's the solution? We need to calibrate the number being produced. We need to focus on producing doctors for periphery. Just producing more doctors doesn't work. Unlike engineers who typically needs to find a job, doctors can be self-employed. So move on to rural areas and live on. And this talk is mainly intended for orthopedicians around 35 years of age. And please make a note for young orthopods, urban India is saturated. You cannot think of doing practice there until either your father or your father-in-law, sorry to say father-in-law, but your father-in-law is a doctor or a big shot. So it's high time, my dear colleagues, for you to look into rural areas where you can earn a bit and do some service too. One of my professors used to tell me when I am doing PG, see, For whom you have to born is not under your hands, but who is your father-in-law, you can decide that. Okay. if you are if you are that much smart enough and your father is not a big shot or orthopedician, and take some time and take a wise decision, but I don't have any choice because I did love marriage. And what's the need? Why people need rural ortho? The reasons are increasing trauma, highways are rapidly growing, and roads are increasing in Modi government like anything. And in front of my hospital is also one highway came in 2 years. Bone setters, who are these? They are our senior colleagues. They moved to rural places before we thought of going there, so they are already spoiling orthopedic care. So if we need to correct that, we need to provide quality orthopedic care by gaining the trust of people over there on us. Take it granted, they will trust bone setters more than us, more than orthopedicians. We need to break that link and they should bypass them and come to us. That is our responsibility. And next, medical orthopedicians, RMPs and physiotherapists playing with patients' health. Come to the challenge. First challenge, when you say, I am going to start practice in rural area, comes from your parents. What they say? Every parent of us will be dreaming like our son or daughter will start Apollo or Global Hospital or Mayat Hospital, Ramchandra Hospital. Their dreams are endless. So, but we know the possibility, practicality and reality of that. So, first convince them. Next is local old generation docs. When you start a practice there, orthopedics is not a specialized branch in rural India. MBBS doctors, RMPs, physiotherapists, anyone can see our OP. 75% of my OP will come after visiting them only. Unless you decide to practice surgical orthopedics, you will not withstand there for more time. Next challenge is referral. See, rural ortho runs in referrals. All RMPs, physiotherapists, general practitioners will just refer trauma case to a city or town nearby, and I will get the 30% of cuts at no risk. So you should be strong enough to bypass this and get patients. And I like to add one point. See, in my area, an auto guy who will take a case to a big hospital will get 4,000, and an orthopedician who will admit a patient and do surgery, he will get 3,000. It's a waste of time doing all MS, D ortho and all. It's better to buy a auto. Okay. And next challenge is your qualification. Before thinking of going to rural area, what's that? MBBS, okay, they are already there. And then MS ortho, DNB ortho, D ortho, it's okay. For MS people now, seriously, they can think also. And then MCH ortho, and then fellowship in arthroplasty, and then fellowship in arthroscopy. What now? Bye-bye. Your ego will not let you come there to rural India, and the truth is, your skill will be wasted here. So next challenge is spouse. So what she is thinking, before you start rural practice, what she is thinking, whether she is asking you to take a mall or a multiplex every day, every week, every month. So you plan with her, what's her preference, and decide. And then is professional ego. I would like to tell, before I start my practice in 2015, one MS guy used to work there in lab technician owned one hospital. So he used to work there. So he said to one of my relative, he is not MS ortho, I think he is only D ortho. So I came to hear that that's the biggest mistake and biggest professional ego that will kill us, that will not allow youngsters to shine. Okay, get rid of that. If a D ortho guy is looked down by a DNB guy, and that guy will be looked down by MS ortho, and then fellowship guy feels superior to MS, then MCH. This will never end. So what to do? Welcome any new practitioner to your place with a kind heart and real smile on your face. Feel happy as you may get some free time, as he is going to share some OP load of you and you will get free time. Both of you sit over a weekend and do party. That's what we can do. Okay, we are youngsters. We are not going to earn like 60-year-old orthopedicians or people who are running multi-specialty hospitals. Whatever left of patients are there, we need to share among us. And I would like to end this by summarizing my 4 years of experience in rural orthopedic practice. This will be interesting. This is just my journey, my experience. When I decided to start, I need to write my name. What is that? Dr. A. Roopesh Kumar Reddy, MBBS D Ortho. Nothing to write, no special degrees, no fellowships. So what I did? Whenever I see a OP consultation card of any super specialty hospital, that will be like this much size. So how should I increase that? Dr. A. Roopesh Kumar Reddy, MBBS D Ortho, SRMC, Chennai. Luckily I got some gold, so I have written that. And then consultant orthopedic surgeon. This is very funny. Wherever I saw this point, this will be like when I go to gym in the morning, certified physical trainer. It will be like that. Consultant orthopedic surgeon. You need to add that. Okay. That is very important. Bone, joint and spine specialist. So, see, this will be good for rural areas. What is that? Joint. That means fellowship in arthroplasty. Spine. That means MCH in spine. Okay. Bone, everywhere D ortho is there, they will relate to the bone. Okay. And then finally, my ego gets satisfied. And at the end, when your practice shines, nobody will look into your name board also. So this is how looks like my OP card. See how beautiful I have written. And local language will give you extra line. Okay. You can write something. And coming to the hurdles of doing practice, licenses and permissions. Starting from pharmacy license, every other government officer will come to you. Almost you need to take a minimum of 15 licenses and finally get your hospital registered by government. Rules are same for rural hospital and Apollo hospital. I have gone through all the offices. The rules are same for Apollo hospital and for rural hospital. In fact, I will tell you one thing. If you are running a small hospital, you need to struggle a lot to get the permissions than Apollo hospital because government will do work for them. We need to go and request government officers to get the work done. That's the difference. And what about my OPD? I am seeing an average of 80 to 100 patients per day. What about my morning? I will start OP at 10 o'clock and only villagers will come. They will ask nothing. Literally, they will ask nothing. They will speak very less, but the trust is tremendous. They will trust you very much. And evening, small employees, educated people will come. They speak more, but they will never trust you. Okay. But why you should bear them? You need them for publicity. Okay. And what about surgeries? With the development of beautiful highways connecting all parts of India going through villages, trauma is tremendously increasing. So there is need of trauma surgeon more in rural area than a replacement or super specialty surgeon. What about trauma? What trauma cases I usually see? Distal radius and clavicle will be the most common trauma. 50% fall under this. Only 2 distal radius I have fixed in 4 years and no clavicle so far, with excellent results and good functional outcome. That is just because of Dr. L. Prakash and Ortho Global Group. See, the Ortho Global Group and my practice almost started at the same day, same period. That means, when I entered my practice, the principle of treating a clavicle fracture, middle third, is give a dynaplast, give a clavicle brace, give an arm pouch for 1 month. For 1 month. Leave about corporate hospitals, they will definitely fix. Leave that. I am speaking about rural area. See, now what I am doing, I am giving just a dynaplast, and for patient satisfaction, I am giving 1 week or 10 days of arm pouch. And the functional results are excellent with good range of movement. Okay. And then, because the patients will be seeing the functional outcome only. And then tibia and femur, I will be doing closed nailing and then both bone forearm. What about casting and erections? These will be the bread and butter for you in rural orthopedics. Why? My point is simple with the patients. See, if a distal radius comes to me, I say to them, if you can bear a pain, I can do this for 200 rupees. If you cannot, if you pay me 500, I will do under hematomoplag. That's simple. and this hematoma block works like wonder. This I will use for my evening patients who will be teachers and small employees. And shoulder reduction by Dr. L. Prakash method, I have done almost 30 so far with 100% success rate and for a fee of 500. This, when I speak about this shoulder reduction, when you go out of this conference, don't worry that you are not doing any hip reconstruction surgery with Elizarov. Make sure that your endorphin levels are same for the success you get by reducing a shoulder and by doing a hip reconstructive surgery by Elizarov method. That should be the target. Okay. Don't worry that I am not doing hip Elizarov surgery means we will do, man. We will do at 50 years. What's the issue? We will do at 40 years. Okay. We'll start with casting, shoulder reductions, all these things now. And then what about PFO? I did on 2 patients and they were missing after suture removal. I don't know how to take that. Otherwise, all osteoarthritis patients will come monthly and they will ask you nothing. Give me tablets for 1 month. Give me tablets for 15 days. They will not see my face also. So those 2 patients are missing. I don't know how to calculate. Whether it's success, they really get the pain relief or what. Definitely I feel it's success because every ONE patient will come to me. Every month. Those 2 patients are missing. I would like to do more PFOs in future with Dr. L. Prakash sir blessings. Why only simple cases? Why not complicated? Less risk, cool practice, anesthesia issues. Remember, I will tell you one thing. Any ortho case is equivalent to C-section there. In 20 minutes, she will be asking me, Doctor, is that closer? Doctor, is that closer? I will be putting guide wire in PFN. He will be asking, is that closer? And our physician and ICU colleagues should think about rural ICU to go beyond simple cases and do team effort. So what kind of cases you do? Majority will be geriatric intertrochanteric fractures, PFN. Why this? All young patients will run to towns or cities as care on them will be very more. After once you settle for 2 years or 3 years, show them what you can do, tibia and femur nailings will stand. And then every case will stay based on how many people you made to walk in the surrounding villages. That is very important. What I earned, trust, self-satisfaction, money, enough to live happily. Ask me how much you charge for PFN. I can do it for 10,000 also. You will feel astonished, but it's working seriously. It's working. What amount I will get for that night party? That's enough. A plate of chicken and some orange juice. Yeah. Conclusion, I would like to thank the growing technology, Facebook, WhatsApp groups, particularly Ortho Global. So many updates I will get through them. You post a technique in Ortho Global group, I will have a patient sitting next to me to try it on. That much useful it will be. See, when you follow Ortho Global, if you see nice diagrams of Elizarov and all, don't get confused. Your post will come in that soon. Okay, whatever possible, you apply in that. Thanks to my mentors, Dr. Reddy for teaching all surgical skills and tips for doing practice, and great legend, Dr. L. Prakash for his conservative methods of treating fractures and novel techniques, and Dr. Shankar, his YouTube videos about tricks and tips of surgeries. One thing is very important. Who will help you in odd times? Make sure you have your professional godfather. It is very difficult to get. But once you find, be honest and loyal to him. And he will be the one to bring you out of ocean also. You start working, you go in government hospital, you try finding one godfather, you are working in a corporate hospital, see your boss, how he is responding to you, but make sure you will get one good godfather. No one will help you except the bunch of old chaps sitting in this hall and few around this country academically. Take this for granted. Take this for granted. No one will help you in your practice, whatever way. See, that much jealous we are. We should break that ego. Take home message. Which will drive you? Passion on orthopedics or passion on money? Some work for money, not some, maybe many. Few work for passion on subject and they don't count on money. You can do practice or job only one thing which will drive you is one of these. You should have passion on money or passion on subject to do anything, to do practice or government job or corporate job, whatever is there. Coming to work-life balance, many senior surgeons will be speaking on that. And what's work-life balance? See, if you are not willing to take a case of distal radius at 10 p.m. night, then your friend will be ready to take that. You should be ready to accept that and you should not break your rule. This holds good for both job and practice. Why I am saying is, don't think that I want cool life, so I will join a corporate job. If you won't work like a slave in corporate job, your corporate hospital owner will be you should be get ready because you will be replaced by your own junior. Okay? Make some rules and follow them. These are not hard and fast rules. Just these rules are for me. You can write your own because it's up to you. If you can see patients up to 10 p.m., that is your capability. But these are my few rules. No OP after 7 p.m. No emergency surgeries. Why? Because anesthetist won't be there and it will be very risky in rural areas. No OPD on Sunday. And fix a day for family. Travel with friends monthly once. Never feel shy to refer a case. This is very important rule. I will tell you, that was my second day of practice. First day only one patient came. On second day 2 patients came. And on second day, second patient at 5 p.m. in the evening, my staff taken an X-ray. I just came out from home after a good sleep and X-ray looks everything perfect. The knee joint is perfectly normal. I have given a knee brace and some tablets in confusion and around 50 attenders are there. And I am thinking something I am missing because you should never miss your protocol of examining a patient whether you work in a corporate hospital or rural area, whatever. You should follow your principles. So I went back to him and observed the pulse. It was not there. It's a clear-cut popliteal artery injury. I had to convince them and force them to go to CMC Velur. See, they didn't trust. This guy is new to practice and he is telling some bullshit to go urgently within 3 hours and 6 hours. But I forced them to go. And he came back to me after 1 month walking normally. What I said is perfect and that guy is walking all around the town and doing publicity for me. So, don't feel shy to refer a case. And then, after 2 years of private practice, if you feel it's not working out, close it down without any second thought. Don't feel that my relatives may think otherwise, my parents may think otherwise. Don't feel. If it doesn't work out, close it down. And if your colleague takes your rule of no OP on Sunday as his chance and he starts seeing OP on that day, don't get confused. Feel happy. Okay, let him get some money. And both of you party that night. Unwanted guest. This is most important. Prepare yourself to face any professional or personal hurdle that may creep in all of a sudden during your happy journey. Only thing that can save you, get you out of that is another one. If you have a personal issue, only your professional work will get out of that. If you have any professional hurdle, only your personal family will get you out of that. Thank you. Thank you very much. You can WhatsApp me any queries. Thank you.
Excellent, excellent. Very well done. So it was an illuminating talk and I think that deserves an audience. So there may not be many people who are just the ortho here or who are obsessed about qualifications. Still, his philosophy and knowledge gleaned at this age should be a lesson to all of us.